Hi, everyone. You're here because you want to get straight to the point, right? Understand things quickly and thoroughly.
Exactly. No messing around.
That's what we do. So today, we're looking closely at a course called Specialist Lipoedema Management Lymphoedema Training. And our mission, basically, is to figure out why. Why would a therapist actually sign up for this specific course?
What's the draw?
Yeah.
Yeah.
We've got the course summary, entry rules, how they teach it, assessment stuff,
Yeah.
what's in it, what you get with it, and the certification.
So quite a bit to go through.
Definitely. Let's dive in and see what motivates a therapist to go down this specialist route.
Okay, well, the first thing that really jumps out is that it's a 4-module course, and it's led by international experts.
Okay, that's usually a good sign. Implies quality, I guess.
Yeah, it suggests you're learning from people really at the top of their game.
Yeah.
The summary talks about the latest research and guidelines for lipodema.
Right, and a comprehensive overview, so not just scratching the surface.
Not at all. For a therapist wanting to truly specialize, getting that up-to-date, deep knowledge is, well, it's probably the main reason, isn't it?
Makes sense. You want the latest info if you're going to be a specialist.
You really do. It means you, as the therapist listening, get access to cutting-edge stuff from leading figures. You know you're learning what works now.
And it looks pretty broad, too. It mentions everything from the underlying cause, the whole diagnostic process, assessment, staging.
All the way through to treatment.
Right, like surgery, pre- and post-op care, measuring for garments, providing them, even MLD and exercise.
Exactly. That complete picture, that's got to be a huge plus. If you're specializing, you need to know the whole journey.
Absolutely. It means you're equipped to handle, well, pretty much everything the patient brings, not just one part of the problem.
Precisely. And thinking about that, why, again, the diagnostic skills part is massive.
How so?
Well, the course explicitly says it aims to teach the why behind lipodema, the diagnostic process, getting skilled at assessing and staging patients properly. That's not just theory.
No, that's a practical tool you can use straight away.
Right. It lifts your practice immediately, gives you more confidence, gives the patient more confidence.
I can see that. A better diagnosis leads to a better treatment plan, surely.
Definitely. And speaking of treatment, it also really drills down into specific practical skills.
Like what?
Things like excellence in garment fitting, kinesiotaping, and MLD, but specifically for lipodema.
So not just general MLD, but tailored technique.
Exactly. These aren't generic skills. They're fine-tuned for this specific condition. That allows for much more targeted and hopefully effective treatment.
That's a key differentiator then. You're learning something very specific that you maybe wouldn't get in a more general lymphedema course.
Precisely. Mastering those tailored techniques like the specific kinesiotaping or the garment fitting nuances for lipoedema, that's where you can really impact patient outcomes positively.
Okay, so who gets to take this course? Are the requirements tough?
They seem quite specific. It looks like you need to have already done a lymphedema rehabilitation program, part 1 and part 2, or the lymphedema management for manual therapists, plus some advanced modules like compression and bandaging.
Okay. Any other route?
Yeah, or previous CDT or a DLT training. That's the Vauder, Foldy, Casley-Smith stuff. Plus you need 2 years experience after you qualified.
Wow. Okay, so this is definitely not an introductory course.
Not at all. It's clearly aimed at therapists who've already got a good handle on lymphedema therapy.
So the why here is about building on an existing foundation, specializing further.
Exactly. It's an advanced step. It shows therapists are motivated to really deepen their expertise in this particular area of lymphatic disorders.
And how do they actually deliver the course? Is it all in person?
No, it's what they call a blended learning format, so a mix.
What kind of mix?
It includes live interactive webinars, some self-guided independent study, and importantly, face-to-face clinical skills workshops.
That sounds quite flexible. Good for therapists who are already working, I imagine.
Yeah, that variety caters to different learning styles and, crucially, busy schedules. You get the interaction, the self-paced stuff, and the essential hands-on practice.
Trying to make it accessible, but still thorough.
Seems like it. It balances online convenience with that vital in-person skill building.
Okay, so it's in-depth, it's flexible.
Yeah.
What about checking if people have actually learned the stuff, the assessment?
Right. They mention formative and summative assessments. It's quite a range.
Like exams.
Includes things like observation of practical tasks, written assessments, assignments, some research, and online tests too.
So fairly comprehensive. They want to make sure you've really got it.
It definitely sounds rigorous. It underlines that this isn't just about showing up. You have to demonstrate you've mastered the material and the practical skills.
Gives the certification more weight, I suppose.
Exactly. Which brings us to the certification itself. You get a certification of practice in Specialist Lipoedema Management.
And it's CPD accredited.
Yep, 38 hours CPD. But the real juice, getting back to the why, seems to be the benefits tied to the LTA certification.
Ah, okay. What are those?
Well, there are quite a few. Things like being able to use LTA cert and LipoFert after your name.
Professional bragging rights.
Sort of. And permission to use their logos, the FG, MLD certified, and LTA cert logos on your marketing materials. Plus, you get an actual qualification badge.
So it's about building credibility, making it clear you've got this specific training.
Absolutely. It signals that advanced expertise to patients and other professionals.
Are there more practical benefits for their actual work?
Yes. It mentions being able to practice MLD to further enhance outcomes and using an innovative technique for effective treatments. These directly impact the day-to-day care they provide.
Right. Tangible improvements to their practice. What else?
Getting listed on an international directory of lymphedema services, that's potentially huge for referrals, right? Getting patients looking specifically for lipoedema expertise.
Oh, definitely. Visibility is key.
And access to training and support from Jane Wig and team. So, ongoing expert mentorship.
That's valuable. Not just a one-off course then.
Seems not. Plus, access to the latest developments in lymphedema care staying current is vital.
And there was something about a Facebook page.
Yeah, membership in a private LTA certified therapist FD page for ongoing support and advice.
Ah, that community aspect. Peer support. That must be incredibly helpful.
Definitely. Sharing experiences, asking questions. It creates a valuable professional network.
So when you add all of that up, the skills, the recognized letters after your name, the marketing tool, the directory listing, the ongoing support and updates, the community.
It paints a pretty compelling picture, doesn't it? It's all geared towards empowering the therapist to provide better care, build their practice, and really stand out as a specialist.
Okay, and just quickly touching on the actual content again, it covered things like clinical assessment, surgery prep, and aftercare.
Garment selection, fitting, measurement, the MLD, and exercise we mentioned.
Also exercise regimes, weight management, and even well-being and mindset.
Right. That last one's interesting. It shows they understand lipodema isn't just a physical thing.
It's holistic, addressing the psychological side too.
Exactly. It equips the therapist to treat the whole person, which is crucial for conditions like this.
And finally, they throw in support materials too.
Yeah, seems like quite a package. All training support materials, things called lymph balls, research articles, literature, access to training videos, the online learning platform.
So you're not left scrambling for resources.
Doesn't sound like it. Plus, they mention dedicated support from the LTA training team throughout.
That's reassuring, knowing there's help available if you get stuck.
Absolutely. It removes barriers and builds confidence for someone taking on this level of study.
Okay, so let's try and wrap this up. Why would a therapist do this specific course?
Well, fundamentally, it seems to be about gaining really specialized, deep knowledge and practical skills for lipedema, things you can use immediately.
Right. It's not just general knowledge. It's highly focused.
Yeah.
And the diagnostic skills seem key.
Definitely. Plus, you get that recognized LTA certification, which boosts credibility and brings tangible benefits like the directory listing and marketing advantages.
And the ongoing support, the latest research updates, the community. It's not just a course, it's entry into a specialist network.
Exactly. It equips them to offer more effective, comprehensive, specialized care. It's an investment in becoming a real expert in an area where that expertise can genuinely change patients' lives.
It's a clear pathway to specialization, offering significant advantages for the therapist and ultimately for the people they treat.
Well said. It's about elevating their practice and making a bigger difference.
So, thinking about this, the complexity of lipodema and how this specialized training clearly helps improve outcomes. It makes you wonder, doesn't it? What other areas in therapy might really benefit from this kind of super focused, in-depth training for practitioners?
That's a really interesting question to ponder, actually. Where else could that deep dive make a significant difference?